There are some case notes on the screen. So the first thing you need to do is just go to the end of the case note and see what is the writing task. Using this information given in the case note, write a letter of referral to Dr. F. Shaw, 201 Albert Street, South Coddington. And you just can go through like 1 or 2 lines above the writing task, like there is a plan mentioned as refer to pediatrician Dr. F. Shaw, and the assessment is post-streptococcal nephritis with early renal failure. So just reading this section, you have a basic idea in the mind that you need to write a referral letter to like a pediatrician whose name is Dr. F. Shaw. And if you are referring a patient to a pediatrician, it means the patient is like a child. So you just got this idea in your mind. Now we are going to start constructing a letter. So the first thing you need to do is to write the date at the top of the page on the left side. Most of the time you write the date on the letter that is of your exam day, that you are taking the exam on what date. You need to write that date on the referral letter, or most of the time they mention in the case note that use this date to write the letter. So like in this case note they did not mention any date. So what we need to do is to just go to the case notes and see how many dates are mentioned on the case note. Like you can see there is a date mentioned as 25 February 2014. After that there is a date mentioned as 18th March 2014, followed by the third date as 20th of March 2014. So you just got the idea that the patient came to the general practitioner 3 times and the last visit was on 20th of March 2014, and at that visit you assess that the patient is having some serious problem and you're going to refer that patient to a specialist. So you will write that date on your referral letter, that at that date you assume that the patient need to go to a specialist. So you will write the date like 2014, and the correct format to write the date is that you will use double digits for the days and for the month. Like it is 20th, you write 20 slash followed by March is 3. You will not write only 3, you will write 03 because you need to use 2 digits, followed by the year, that is 2014. So this is the correct way to write the date. You just need to memorize it. There are a lot of different ways to write the date, but you just need to memorize one, because if you remember all of the different formats, you will confuse yourself and you will make a mistake. You don't afford to make a mistake in writing the date. So just memorize that you need to write first of all days, followed by month, and followed by the year, and you used to use double digits on writing the date. So after that you need to write Dr. F. Shaw. And how you know that you are writing a referral letter to Dr. F. Shaw, that is mentioned in the writing task. So you will write exact same spellings that are mentioned in the writing task, Dr. F. Shaw, and there is a comma after that. So there is a basic rule that applies in the writing task, that whatever is written and they put a comma there, it means the next word will come in the next line. So when you write Dr. F. Shaw, there is a comma there, that means whatever you need to write next will come in the next line. So Dr. F. Shaw is a pediatrician. We came to know about that he is a pediatrician, that is mentioned in the plan. So what we will do in the next line, we will write pediatrician, and we will write P for the pediatrician in the capital letter. After that we will write the address, and the address is 201 Albert Street. You need to write the exact same spellings that is mentioned in the writing task. You cannot afford to make mistake in that. So 201 Albert Street, there is a comma there, that means you need to write the next word in the next line. So the next line will go like South Coddington, exactly the same. So that way you just completed the date and you just completed the address in the correct format. Next we will write the Dear Doctor. So in the Dear Doctor section we will write as Dear Dr. Shaw. We will not use F dot because it is just a general rule that when you are addressing an adult or a patient or a doctor, we will use just the last name, and the last name is Shaw. If there is a patient who is less than 12 years of age, like the boy, we will use the first name. So we just need to remember that in this section. So we will write Dear Dr. Shaw, comma. Next we will write the regarding statement. For the regarding statement we will write R small e followed by colon, and after that we will write the name of the patient, comma, followed by whatever years of age. So in the case note we can see that there is a mention that Relay Precious is a patient in your general practitioner. He is 4 years old, boy accompanied by his father. So we got the name of the patient. The name of the patient is Relay Precious. So in the regarding statement, we will write the complete name of the patient. Either he is an adult or is a child, we write the complete name. And when we came down in the purpose expanded section, we will just use the first name if the patient is like less than 12 years of age, and we will use the last name of the patient if he is or she is an adult. So we will write here like really precious, 4 years of age. Whatever the age of the patient, like 4 years, 15 years, 20 years, you will write 15 years of age, 20 years of age. Again, there are a lot of different formats to write in this section, but just memorize one so that you will not confuse yourself or make a mistake. Next, we will write the purpose statement, and I have already given you the free template to write the purpose statement. So we will write the purpose statement as I'm writing to refer relay. We will not use precious here because we need to save words, and our letter will be like 180 to 200 words. So we have already mentioned the complete name in the regarding statement. We do not need to write the complete name in the purpose statement. I'm writing to refer relay, whose features are consistent with post-streptococcal nephritis. Here is one thing you need to remember. When you come to the case note, at the end there is like assessment thing. And in the assessment thing, the general practitioner assesses that the patient is having post-streptococcal nephritis with early renal failure. And after the renal failure, there is no question mark or there is nothing mentioned here. It means that the general practitioner is confident that the patient is having this problem. If there is like a question mark here, it means that the general practitioner is not sure of the condition the patient is having. In that case, we will use the word suggestive of. But in this scenario, the doctor is confirmed that the patient is having this problem, so we will use the word consistent with. So I'm writing to refer relay, whose features are consistent with post-streptococcal nephritis with early renal failure, and after that we will write for further assessment and management according to that template. So we have successfully completed the purpose statement. Now we will come to the purpose expanded thing. As we can see, it is a normal referral letter, so the format we need to follow is purpose followed by past, family, personal history followed by the first visit. After that there comes the subsequent visit followed by the last visit, and at the end there will be the closing. So in the case notes we can see that there is no mention of the past or personal or family history. It means they made the task easy for us so that we don't need to write that thing. So we'll start with the first visit, that is on 25th of February 2014. And how to write a visit, I give you a template for that as well. First of all, you will write the presenting complaint followed by the examination, followed by any radiological finding, followed by any blood test, then followed by the prescription, followed by the advice, and at the end you will write any investigations that were ordered. So we will write like on 25 to 2014, relay presented with the complaint of fever, sore throat and husky voice. So we started with the presenting complaints as that was in the sequence, and we transferred his complaint as sore throat, husky voice and febrile or temperature 13 as a fever. After that we write the statement as on examination, the tonsils were enlarged and exudative along with the tender enlarged cervical lymph nodes. So in this particular visit we covered the presenting complaint followed by the examination, but there were no mention of any radiological finding or any blood test. There is a mention of prescription we can see, but there is no mention of again any labs ordered were done. So we will write here like tonsillitis was suspected and penicillin was given according to the format there. Successfully we have completed our first visit. Now we will come to the subsequent visit as that was in the format we have already in our mind. On subsequent visit, relay looked tired and lethargic, examination revealed that. One thing you need to remember is you need to keep changing words. In the above paragraph you write as on examination, in this paragraph you write examination revealed that. The meaning is same, but you are just changing the word, and changing the word in different paragraph is really crucial so that the examiner is aware that you have a good command on the vocabulary. I will give you some other alternatives for the common words that we will be using in the letter construction, like you can write on examination, or you can write her examination or his examination revealed short. You can write presented, or you can write visited or reported. You can write on subsequent visit, or you can write on reviewed visit, or you can write on her next visit. And there are a lot of different words that I'm going to mention on the screen. You just take note of that. Now let's get back to constructing our letter. So examination revealed that there was a tonsillar hypertrophy and urine analysis revealed macroscopic hematuria, These findings were suggestive of post-streptococcal nephritis or urinary tract infection. After that, he was advised to drink plenty of water and relevant investigations were carried out to review in the next 2 days. So as you can see, you followed the same pattern in this paragraph as well. First we talk about the presenting complaints that were tired and lethargic, followed by the examination. After that, there were no radiological findings, but we mentioned about the blood tests that were done and the urinary tract infection. After that, there is no mention of prescription here, but the mention of advice. So we write about like he was advised to drink a plenty of water. After that, there is a mention of like the investigations that were carried out. According to that pattern, that investigations mentioned will be at the end. Now let's construct the third paragraph of our last visit. It will be the last thing of our purpose expanded thing. After that, we just need to write the request and the closing statement, and our first ever letter will be completed. So just quickly go through the case note and complete the purpose expanded thing. So we will write it as on 20/03/2014, relay seemed fine. So his asymptomatic thing, we just turned it to seemed fine because he's asymptomatic, and we start with the presenting complaint. Relay seemed fine. His blood pressure was a bit higher than previous visit. We covered the examination thing as well. Now we need to write about the radiological finding or blood test or any prescription and advice or the investigation. So we will write as labs report showed elevated urea and creat and RBC cast in urine were of renal origin. We will not write about the thing which is normal because we need to save words, and these things were the major that were elevated, so we write about that in the purpose thing. So that's it, we have completed our third paragraph as well. Now we just need to write the request and the closing. To write the request, we will go back to our free template. It says that we will write it would be really appreciated if you could take him under your care. That's a perfect request. And now we will close the letter and we will write the closing statement as please do not hesitate to contact me if you have any queries. You just need to remember this line in whatever the closing you are having in a letter. You just write this line, it will be perfect. And at the end you will write on the left side yours sincerely, So there is one thing you need to remember. If you know the name of the doctor, that in this scenario you know the name that the doctor is Dr. F. Shaw, so you will write here as yours sincerely. But if you do not know the name of the doctor, like I will discuss in the next letter, like there is a letter to emergency doctor or ED doctor where you don't know the name, you will write here as yours faithfully, So these are the only two scenarios you need to remember. If you know the name of the doctor, you will write yours sincerely, If you do not know the name of the doctor, you will write yours faithfully, After that you will leave 2 lines and you will write doctor dot on the left side. So this way you have completed your first ever letter. And if we look at the marking of this letter, you got like 360 out of 500. So not bad. It is your first ever letter and you just learned some rules in this letter as well.